Hello class, my name is James Njeri. Today I'll be presenting on the future of healthcare for the state of Maryland. I'll be talking on the topic of expanding preventative care for diabetes and obesity in Maryland. This is part of my Nurs505 course at the American Military University under the guidance of Dr. Loftus. So diabetes and obesity continue to pose significant health challenges to communities in Maryland. The most affected are the low-income and middle-income earners who may lack access to health care insurance coverages. And this lack of access means they must dig deeper into their pockets to finance healthcare costs, especially for chronic conditions. This is according to a study by Selvey in 2023. So although the Maryland state government has made significant strides to expand healthcare services, many communities still remain left out, especially due to social and economic factors. So public stakeholders have relied on policy design and implementation to address the institutional and systemic factors that undermine healthcare access. So some of the policies they may propose include the three policies I discussed earlier in the topic, which were the Maryland Wellness Policy. Second one was a policy on increased taxes on sugary foods and beverages. And the last policy was expanding on preventative care for diabetes and obesity. So this week I'll build upon that third strategy because selecting the policy for expansion of preventative care is the most effective policy, and I'll also provide a rationale for the selection based on the perceived impacts on patient and healthcare professionals. So what's the rationale for choosing the policy? So the policy to expand preventative care services for diabetes and obesity aligns with the healthcare principle that preventative care prevents basically future healthcare complications and cost implications associated with rehospitalization. This is according to Selvey 2023 study. So preventative care services will encompass screening services, nutritional counseling, lifestyle support, and timely management of symptoms. So past empirical studies have supported the services and have demonstrated them as effective evidence-based preventative care interventions to counter diabetes and obesity. A policy supporting their expansion will help fight against the rising incidence of diabetes and obesity in Maryland. So a 2023 report by the Centers for Disease Control CDC revealed that early detection and prevention through lifestyle changes reduces the risk of developing type 2 diabetes by about 58% in adults. So that's from Center of Disease Control 2024. So a policy on expansion of preventative care will include funding for equipment and resources, stakeholder engagement, and sustainability. So a lack of funding has always been a significant hurdle that public healthcare stakeholders must navigate when expanding healthcare access. So this is according to Alabad 2024. So therefore, adequate funding would make preventative care programs more effective since healthcare professionals will be well equipped to handle the rising demand for preventative care services for chronic conditions. So an effective policy often relies on its sensitivity to the political landscape that may be around. So the policy on increased taxes on sugary food is highly politically and very sensitive. It may even incur legal ramification in short and long term. This is according to Mapo and Powell 2022. So legislatures must face industry players who may resist taxes that impact their businesses. Again, this is according to Alabama 2024. So they may also finance other legislators to lobby against the implementation of increased taxes. And so Maryland's wellness policy is also moderately sensitive. So that means it just requires private and public companies to implement wellness programs for the employees. So small and medium-sized enterprises may resist and finance legislatures to lobby against the policy. Again, according to Shah and Villegas 2022. So my chosen policy on expanding preventative care services is less politically sensitive since it only requires a budget adjustment. So supporters of the policy may emphasize its long-term cost effectiveness to other legislatures who might be trying to resist its implementation. So since it's likely to face less resistance, concerned stakeholders will have an easy time implementing and sustaining it. Furthermore, the policy aligns with the U.S. Department of Health and Human Services Healthy People 2030 objective, which emphasizes preventative care to improve population health. Therefore, it's likely to get funding from the state government and donors. This is according to Alabama 2024. So expanding preventative care services will bring many stakeholders from different sectors, creating a sense of ownership among Maryland residents. So the high stakeholder engagement will improve policy design and implementation and guarantee the sustainability of preventative care programs, again, according to Alabama 2024. So for example, faith-based organizations and community healthcare centers will ensure continuity of preventative care programs in rural and underserved areas. Monitoring and controlling the preventative care programs will be easy due to a high level of stakeholder engagement. Each party will report any rising challenges and perceived risk, allowing for early risk mitigation and prevention. So why is this the best choice for healthcare technicians? So healthcare principles have often emphasized preventative care to counter worsening symptoms and avoid additional costs associated with uncompensated healthcare costs and rehospitalization. This is according to a study by Sawyage 2024. So therefore, the policy on expanding preventative healthcare will empower healthcare clinicians to utilize their evidence-based skills to implement high-quality preventative care. So they will engage in patient education, symptom management, and screening programs for underserved regions and low-income communities. In addition, nursing leaders will recruit more healthcare clinicians into preventative care programs and equip them with evidence-based skills to offer high-quality care. Again, according to Sawyage 2024. So increased federal and state funding for preventative care programs in Maryland will promote skill and workforce development. So many young nursing staff will enroll in preventative care programs due to attractive incentives and professional development opportunities. Community healthcare workers will improve their skills in healthcare risk assessment and mitigation. And due to awareness and patient education programs for underserved and rural regions, community members will acquire critical healthcare skills in managing obesity and diabetes. Again, that's according to SAYEG 2024 study. Healthcare facilities expect to incur low healthcare costs associated with rehospitalization due to preventative care programs. Rehospitalizations due to worsening symptoms often impose significant pressure on existing healthcare resources in Maryland, according to SAYEG 2024. So therefore, preventative care programs to reduce incidence of obesity and diabetes will reduce that pressure, allowing healthcare facilities to invest more financial and intellectual resources in preventative care. So victim compensation costs will also be reduced, allowing healthcare facilities to save costs and invest in other critical healthcare programs. So the policy on preventative care aligns with the American Nursing Association Code of Ethics, which emphasizes preventing illness and promoting population health, according to Selvin 2023. Therefore, it enables them to fulfill their ethical duty. Enables them to fulfill their ethical duty of preventing patients from getting diabetes and obesity. So the policy also aligns with the principle of non-maleficence that advocates healthcare professionals engaging in healthcare preventative practices that prevent harm and suffering to patients. So the selling point for advocacy and policy development. So legislatures lobbying to implement the preventative care program for diabetes and obesity will use the program's cost effectiveness, positive implications, and population health and with the alignment of the U.S. Department of Health Services Healthy People 2030 objective as the selling point. This is according to SAYEG 2024. So past empirical studies have proven that treating cost implications is far more expensive than preventing them. So for example, a 2024 finding by the American Diabetes Association revealed that the United States spends approximately $400 billion annually treating diabetes. This is from the Diabetes Prevention Program 2024. In addition, a 2021 study conducted by Trust for America Health found that investment in preventative care programs for chronic conditions have returned $3 for every $1 spent. This is according to Trust for America Health 2021. So economic legislators and healthcare administrators are often on the same page regarding reducing additional costs in the healthcare system. So they are actually aware of how additional costs might undermine the sustainability of healthcare programs to improve population health. Therefore, policymakers will support its implementation, especially by advocating for immediate and sustainable funding. So faith-based and community-based healthcare organizations will also support initiatives to promote population health. That's according to Alabert 2024. And finally, legislatures and other stakeholders will argue that preventative care programs promote population resilience, healthy population support, and enhance economic growth, reducing our dependence on inpatient and emergency care services. The state government will utilize the additional funds required to invest more in preventative care programs, allowing many communities to access preventative care, according to Alabama 2024. So, in conclusion, the policy on expanding preventive care represents a forward-thinking approach to counter incidences of diabetes and obesity in Maryland. It addresses a lack of finance, an economic factor that has made it difficult for many residents to access preventative care. Programs to improve community outreach will ensure that high-risk adults access the necessary and urgent preventative care. It stands out from the policies as the most effective and easy to implement because it ensures that policymakers, legislatures, and other parties reason together and agree on proposed implementation strategies. These are my references, and thank you for listening.